This segment is sponsored by Advanced Medical GI. It's the start of a new year, and for many, weight loss and better health are at the top of the list. But too often, quick fixes fall short and don't last. Dr. Richard Blosser from Advanced Medical GI joins us now with the program focused on lasting success. Welcome back, Dr. Blosser.
Thank you so very much for having me.
Yeah, of course. Why is it that it's always the start of the new year that really kind of invigorates everyone to think about getting healthy?
We've known now for years and even decades that weight is the single most threat to the American society with regard to health issues. So when you have 1/3 of the U.S. population that is morbidly obese or overweight, we've got to address that. And we've looked at many different ways to do that, surgically, medically, mechanically, and now a lesser invasive endoscopic approach.
Yeah, and you have been taking the lead in this area, especially on endobariatric procedures. For anyone who's unfamiliar, can you just tell us more about that?
Please. So the bariatric procedures, bariatric surgeries have been around for about 25 years, and they are surgical procedures that involve actually taking a segment of your stomach out or rearranging your organs so that you are malnourished, you're not absorbing. What the endobariatric approach is with the advancement of endoscopy, we can now do similar, almost identical procedures, but with lighter sedation, quicker time, safer procedures, and with just as good, if not better, outcomes.
Yeah, seeing great success. Injectables are something we hear a lot about, but I know there's side effects with those. Can you talk about that?
Absolutely. So as much as 25% of the GLP-1 and GLP-2 have at least 25% side effects, and that's consistent across the board. Some of those side effects, especially in the African American population, can be quite devastating, whether that be renal failure, kidney failure, or pancreatitis. So we've got to look at other things that are more enduring, because once you do stop the GLP-1s, your weight comes back because the suppression mechanism by which they work is gone.
Yeah, we don't hear enough about that, but we keep seeing everything about the GLP-1s. I mean, it's all over Instagram, it's everywhere. We don't hear so much about all the side effects and the fact that the weight comes back right when you stop.
That is correct. And without the proper mechanisms and the concepts behind what we do are that we're actually not only making the mechanical aspects of the stomach different, but we're also giving the feedback to the brain without having to suppress with the GLP-1s the mechanisms that tell us to stop eating when we get full. So lo and behold, there's twofold. One is the training, two is the actual mechanical aspect of remodeling the stomach with the endobariatrics.
And we talked about the side effects with the injectables. How does that compare with the bariatric procedures?
Right, so the bariatric procedures as an outpatient endoscopic procedure carry a less than 1% risk of complications. When you look at 5-year data, the ESG, endoscopic sleeve gastroplegia, is now approved, has a CPT code that was just came into effect on January 1st. So we know that the 5-year lasting duration of these endoscopic approaches are fantastic, and they actually work well. Whereas with the surgical approaches, the complication rates can be as much as 12% to 15%, and then with the injectables, it can be as high as 25%, depending on the patient population. So obviously, we're working in the right direction. We're lesser invasive. We get as good, if not better, 5-year outcomes, and we're cost effective.
Yeah, and a cleaner side effect profile.
No doubt about it.
Yeah. Thank you so much, Dr. Blosser. This was really, really informative. Thank you.
It's a privilege. Thank you for having me.
Of course. If you'd like to get more information or make an appointment with Advanced Medical GI, you can call 833-453-9522. Again, that's 833-453-9522, or you can go to amgimed.com.